Bring in Rosalia Bollen, a communication specialist at UNICEF, the UN's children's charity. She joins us from the Netherlands. Rosalia, thanks very much indeed for your time. You join us on yet another desperately sad day in Gaza. People dying trying to get food, children and babies malnourished and struggling to survive themselves. What's your assessment, first of all, of the Gaza Humanitarian Foundation, the organisation that's been tasked with handing out humanitarian aid?
Now, the United Nations, including UNICEF, has made it very clear that we aren't able to work with them, and because of a whole host of reasons. Firstly, because of the way they operate is unsafe. We've all seen the images coming out of Gaza day in, day out, with people being shot at, people being injured, or worse. Nobody should have to choose between starving or risking their life to get food aid. The system they operate is also really unfair. It's unfair because they put out a limited quantity of food and tell people to just come and get it. And that means that the law of the strongest is going to apply. Obviously, if you're a young man and you can run fast and you're strong, you stand a better chance of getting your hand on some aid than when you're a pregnant woman, you're elderly, you are a child. They don't stand any chances of getting aid. The system is also really ineffective. They have 4 distribution points in southern Gaza. UNICEF alone has hundreds of points throughout the Gaza Strip, including in the northern part of Gaza, where we continue to provide life-saving assistance. We continue to hand out nutrition supplies, therapeutic products for children who are malnourished, also medicines and supplies for hospitals. We continue to provide clean water. We produce water, clean water, and then we bring that throughout Gaza. So this whole system is unsafe, it's unfair, ineffective, and unnecessary. A good alternative exists.
And what's even worse is that all of this was predicted in advance. The criticism of the GHF was that it was being privatized, politicized, and militarized. And that's exactly what we've seen, not to mention 4 distribution hubs is nowhere near the kind of setup that the UN had in place before that.
Absolutely. So the way that we operate is completely different. It couldn't be more different. When we have therapeutic food for babies, we don't go out in the street and tell people, okay, just come and get it. We actually carry out malnutrition screenings. Last month, over 100,000 children were screened. And those who are found to be acutely malnourished or at risk, they receive support. We currently have 170 points where we do this malnutrition screening. So we're really embedded in the communities. People don't have to walk far. We actually also go door to door to screen babies. We come and then based on their situation, they are going to receive specific support. So this is a completely different approach than what we've seen lately from these distribution points in southern Gaza.
Yeah, and the reality of newborn babies and the difficulty getting milk was really brought home to us earlier. We heard from one new mother who said she had difficulty getting the right kind of baby formula. Anyone with children or is in contact with them will know sometimes that's a real problem, even if you're living elsewhere in the world, let alone a war zone.
Yeah, what we're seeing in Gaza is a situation of engineered scarcity. Not enough of everything has entered the Gaza Strip throughout these 21 months, with the exception of the ceasefire earlier this year. So everything is in short supply. Infant formula, as you highlighted, but also things like nappies, food, medicines. The sad reality is that infants and children are the first victims of this scarcity. Malnutrition, in fact, is skyrocketing. From February this year up to June, we have seen 180% increase in children who are acutely malnourished. And that is just just preventable, it's unnecessary. We have the supplies ready to be brought in. Malnutrition is dangerous for children. We're talking not just about low weight, but also about growth impairment. Children's bodies are still developing, and stunting and malnutrition is not something that children can easily recover from. They need very specialized care right now that unfortunately is largely unavailable.
Rosalia, we really appreciate you joining us on the News Hour. Good to get your thoughts, despite it being such a desperately difficult story. Rosalia Bollen there from UNICEF.